I'm Billy Cioffredi from Cioffredi and Associates, and I wanted to share with you an exercise that we use that's particularly useful for people that have plantar fasciitis, heel pain, arch pain, some people with posterior tibialus, tendonitis. And Becky's going to be able to demonstrate this for us and some of the unique aspects about it. The one thing that is particular about this stretch is that different from your usual stretches that you have for the calf muscle, this one is going to take up slack from both the hamstring and the calf muscle simultaneously, and that's the difference in it. So Becky, what I'd like you to do, I'm going to have you bend forward to put a stretch on that, and Becky is an avid yoga practitioner, so she has a lot more flexibility than most of us. But go ahead and go forward, Becky, and that's pretty easy for her to do. Good. Come on back up for a moment, and I want you to pay attention to this area of her ankle. In doing the stretch in the way that gets the purpose out of it, of what we're looking for, it's really critical that the arch is in, the ankle and the arch is in the midline position, or we'll call it the neutral position, so that it's not turned outward, but in particular it's not turned inward, which is pronation, and something that's often seen. A lot of people, that's where their body easily gives, and so that's part of what happens with their movement. So that movement takes place through the whole leg, and so the correction is to maintain the right alignment through the whole leg that ends up in the ankle and arch itself. All right, Becky, so you're going to keep your arch in the right position on both sides. This one, just slightly bring your arch up, right there, and let it down a hair, right there. Good. Good. So maintain that now as you go forward, keeping your knees straight and you're flexing right at the hip, keeping your back straight. Good. So her back is straight, she's flexing at the hip, keeping her arches in the right alignment there. Great. Now, what you'll find with people is that if their arch is in the wrong alignment and it's corrected, they feel the stretch or the pull in a different location in their calf. And that's what you're looking to get out of it. Now, once you face that way, Becky, and we're going to just point out a couple of the other important parts of this stretch to do it properly. So the other aspect that's important, besides the alignment of the arch, is that the leg is vertical and perpendicular with the floor, and that the knee is straight, but not beyond straight. So that's what you've got to concentrate on, Becky, to keep that correct. So this time I want you to do that, keeping your leg perpendicular. Very good. Just going to lift this up so we can see where your knee is. And I'm going to have you move just slightly forward that way. Perfect. Good. Do you feel that through your calf at all?
Yep.
Now I want you to stay there, but I'm going to have you show me a couple of things that people typically do with this.
Okay.
Does your knee go, bring your body weight back this way like you're keeping your balance, or you're just going to come back this way? Yeah. That's more often what we see, even a little more if you want. That's right. The people, in keeping their balance, end up doing that. All right, come forward a little bit. Does your knee go beyond straight, Becky? There. And that's the other thing that we may see that's not the normal way of doing this. So those things have to be corrected for it to be done correctly. Good. Come on back up. Very good. Thank you.